the Primary Care Commissioning Committee. My name's Chris Nield and I'm the chair of the committee. It is being recorded, and I'd just like to go through our apologies for the meeting to start with. So Ronnie, have you got the apologies? I've got from the voting members, I've got Professor Mark Gamsu, lay member, Mr. Brian Hughes, Director of Commissioning Development, and Judy Thornley, who's a lay member who may join us a bit later. Have we any apologies from non-voting members, Ronnie?
No, Chris, I was still waiting to hear from Nikki Bates and Sarah Burt, but I haven't received any apologies from non-voting members. Jackie?
I think we've got confirmation that Zach won't be able to join us till 2 o'clock. So I think he's due to join then. Yeah, I think that was it. Oh, and sorry, and just to note, Brian's title is Deputy Accountable Officer, not Director.
I thought that was wrong as I was reading it. Apologies for that, Brian. We also have apologies from those normally in attendance, which is Mr. Greg Fell, Director of Public Health, and Dr. Trish Edney, Health Watch representative. In terms of declarations of interest, can I ask for declarations of interest for this agenda and for any particular items from the committee today? No, I don't think there is, having had a look at it in advance. But if something comes up through the discussion, please will you draw my attention to it? Thank you. As far as I'm aware, we haven't had any questions from the public. Is that correct, Ronnie?
It is, Chris. No questions received.
Just spotted Leslie. Thanks, Leslie. We hung on for a couple of minutes, but we've only just started.
Apologies, Chair.
That's fine. It's tricky times, isn't it? The next item is the approval of the minutes. So if I can go through them page by page, and if you can pick up any issues that are incorrect or missed. So for page 1, page 2, page 3, page 4, page 5, page 6, page 7, page 8, page 9, there is 2 more pages that I haven't got copied onto my, I'm not on my screen, I've just got printed off. So are there any other matters arising on those pages? Okay, thank you. So if we can accept that as a true record and then go straight to the matters arising. So the first matter arising is about the analysis of the spend in relation I think it was to do with the locums, but I understand that, Jackie, this is work in progress.
Yeah, the main problem is that when we receive data, it's based on when people submit claims, not the period with which those claims relate to. So it's a bit lumpy in terms of actually being able to draw some conclusions. So we have seen, as I'd reported previously, a significant increase in the cost of locum claims, mainly associated with levels of sickness, and they continue to be a lot higher than previously. We have planned for them to come down slightly, but they're probably not coming down as quickly as we would have hoped. So I think given the focus we've had on doing the plans, we've not made any further progress on that analysis. So I'll leave that open for a future meeting.
Thank you. Thanks, Jackie. And the next item, Abby, which is about the Opel report.
Yeah, I've agreed to talk to Dr. Savage about this separately, so we can come to an agreement. There is an added layer to this now we are reviewing Opel reporting for the whole city, I understand. So we need to dovetail plans for primary care into the citywide plans. We're picking up those conversations now.
Thank you. Thanks, Abby. The next item is recommended for closure, because that's the second half of the year that's on the agenda. Thanks, Jackie. And then the ARRS roles currently in post and allocation. So I think, Abby, you wanted to actually move this to a quarterly reporting so that we weren't going into it on a monthly basis.
Yes, so there has been a request to include ARRS, the PCN additional roles that are currently in place in the workforce report we produced. I'm proposing to refresh the workforce report. The first version, obviously, we shared in September. I'm proposing that we refresh that on a quarterly basis rather than for every meeting, because there's sort of limited movement between reports otherwise. So it seems sensible to do that on a quarterly basis, so we can include ARRS information in the next report, which we'll bring to the committee in January.
Thank you. Jackie, you've got your hand up.
Yeah, just to add to that, because we've had, because I think that's a sensible approach, but we've had an update from primary care networks on their plans, which have included as part of the finance report. So I'll cover that in that report.
Thanks, Jackie. Okay, are there any other matters arising that haven't been covered on our the document? Okay, so if we can go then to the next part, up to part 2, and look at papers for approval and the local GP retention plan. Abby, can I hand over to you?
Yes, of course. I have to apologise to the committee. I had intended to circulate paper for approval on this. However, that has been delayed slightly by the work that's ongoing around the winter access funding that's referenced in the paper for noting. So what I am proposing to do is circulate the proposal virtually for committee's consideration and approval, and then we'll bring that paper back formally in January to confirm what's been agreed. The plan that we are looking at is to implement the first step of the plan we're looking at is to implement a local scheme within Sheffield to provide a similar level of support to that described in the national scheme for GPs who are returning from long-term sick leave. So this does link in with the discussion around the locum, the locum sickness cover, to offer support to those GPs in their practices so that they can have a supported and phased return to work. I'm going to be linking with the LMC to understand what additional support it might be advisable to wrap around those GPs and the practices that they're returning to. That the advantage of doing that on a local basis is that we can tailor the commitment to meet the availability of funding we have, and the fact that we can't commit that on a long-term basis, but we're looking to put that support in for as long as we can to help bring those GPs back into practice. It seems particularly pertinent at the moment, given we know we have a number of GPs who have had COVID or have long COVID and will need some support to get back into practice, and we don't want to lose them from the system, from the service completely.
Okay, David.
Yes, I had a chat with Abby about this beforehand, and I'm happy with the approach. All I would say is there any way we can approve it virtually
Yes.
before January? Because if it's non-recurrent money, it would be helpful to get it out earlier than that.
Sorry, yes, David. Sorry, what I meant was that we'd get virtual approval from the committee, but ratify it but formally confirm it in January. My apologies.
Thank you.
Yeah, there's significant work going on with the winter pressures work and responding with our Sheffield response to some of the government policy at the moment. So, you know, we have unfortunately had to delay producing this paper. Okay, thank you. So if we can move on to the next item, which is the H2 budgets. Is that yourself, Jackie?
It is. It is, thanks. So I'm Jackie Mills, I'm Director of Finance of the CCG. The key points I'd like to draw out from the paper for PCC today are the following. So PCC will recall that we approved the financial plan for the first 6 months of the year at our meeting in July. And we noted at that point that there was significant financial pressures forecast and target savings of about £1 million in the first 6 months that we needed to deliver. So NHS England issued new planning guidance on the 30th of September for the second 6 months of the year. So they're referred to as H2, so half two. And the arrangements for half two are similar to those that were in place for the first 6 months. So we received updated system allocations that were issued alongside the planning guidance, and that confirmed that for delegated primary care, the allocation was the same as in H1, excluding the additional allocations that we had for long COVID, direct and enhanced service and the COVID capacity funding. And they are in line with the previously published allocations. So unlike the rest of the CCG, the allocations for delegated primary care were in line with previously announced allocations. But because we've got the same funding for the second half of the year as for the first, the same level of financial pressures roll into the second half of the financial year. But I just wanted to draw out that, so although we've got a recurrent budget pressure of £2 million on delegated primary care, we are forecasting that half of this can be mitigated through the use of the contingency reserve, as well as lower than expected growth in practice list size, the release of a reserve for premises revaluations, and an underspend on directed enhanced services. So a recurrent pressure of £2 million looks like it will translate into £1 million for the current financial year. And in addition to that, we are forecasting an underspend of around 300k on locally commissioned services. So that leaves a net forecast overspend of £700,000. But we are still looking to review whether there are further mitigations that we can identify to bring that forecast deficit down further. So in addition to that, I just wanted to draw out the point that we mentioned earlier about the additional roles reimbursement scheme. So we've now received a revised forecast spend based on updated plans from the primary care networks. So the previous estimate that I reported was based on current rates of expenditure continuing, and that was around estimating that about 1.9 million of the central funding wouldn't be utilised. But having used the revised plans from the networks, the forecast does increase quite significantly. But I do need to emphasise that that forecast is based on a number of assumptions by networks about their planned recruitment. And we know that networks are struggling to recruit and as well as retain staff. So based on their revised forecasts, the average spend in the first 7 months was around 400k a month. That will need to nearly double to increase to the forecast that the networks have given us. So it is a significant amount of increased spend. But if it does translate into reality, that is a significant increase in workforce as well. So as always, we will continue to review that expenditure forecast, but as I've previously informed the committee, we do need to note that any slippage against that forecast will be retained centrally by NHS England. And then there was just one final point I wanted to make, which isn't included in the paper and probably references the discussion we just had on the previous item. We have discussed at length the significant pressures currently being experienced in general practice at this committee previously. As Abby and Chris have noted, NHS England have recently announced additional funding to support access to general practice over the winter period. So if we were successful in securing that funding, and I think we're going to just cover this in our private meeting as well, just some of the issues associated with that, we would receive significant additional funding into Sheffield, which alongside some of the other funding that we've got in our plans could make a real difference to supporting our practices. But we will need to work at speed to agree these plans once we know the funding is available. So I'm therefore requesting that this committee approves that Chris as chair, I'm sorry Chris, I haven't discussed this with you, so hopefully you're happy with this, but alongside the exec members of this committee have authority to agree these plans, and then we'll report that back to future meetings. Obviously, you know, we will share that with the committee in full, but if we can just delegate to Chris and the execs that authority, that will allow us to move at speed and make sure that this non-recurrent funding gets out to practices as soon as practicable. And as always, we'll engage the LMC as part of that process as well. So if you're comfortable, in addition to the recommendations in the paper, if we can just agree that as well, Chris.
Yes, I'm happy with that. There's already been quite a lot of work in terms of feedback about the Sheffield approach to this. And I think we do need to act on it quickly. We're not far off December as well. David.
Yeah, the LMC are involved and we agree with the CCG approach. Just two questions. One is more specific one on there seems to be a significant increase in interpreting services in the second half of the year. And I wondered if there was a reason for that. And then secondly, I was just asking NHS England or Victoria if the picture was the same with the ARRS roles across South Yorkshire. Are they all struggling to recruit?
Shall I pick up the first question then? Sorry, and it's gone out of my head immediately, David, sorry.
Have I muted myself? No, about the extra spend on interpreting services in the second half of the year.
Yeah, no, that is actually related to the fact we are currently going through an exercise to re-procure the service. So we have provided for some additional costs associated with that. So I don't know if Lucy, you can confirm the timescales for that procurement.
Currently, it's the new contract will be in place at the end of the year, but we're in discussions with the council to extend that just because we realise that December, January, we should have realised before, isn't the best time to introduce potentially a new contract. But I was just thinking the increase in costs might also reflect that GPs are now doing more face-to-face appointments. So actually the cost of face-to-face interpretation will go up because telephone's a lot cheaper than face-to-face. So it might be a bit of that as well. Thank you.
Can I just answer David's question around the R's? So yes, David, I think everybody is in a very similar position. I think as Jackie's described, obviously the intentions are based on PCN's recruitment plans, but you know they are not guaranteed. So I think yes, everybody is in the same position overall.
Thank you.
Thank you. Jackie, can I just in terms of clarity, so this committee is it's overall the governing body agrees the budget, but because of conflicts of interest and the particular important that the primary care committee approves this and then it goes back. So just for clarity of everyone looking at this, because it does also need to be approved by the governing body. So if you confirm that I've got it right, I've not got it the wrong way.
You got that exactly right, yeah.
Thank you, which is helpful. So we've, in terms of accepting the recommendations and also to do some work electronically so we can progress this work before the next meeting, which we'll report on in the next meeting. Thank you. Have you got the detail of that, Ronnie?
Have, Chris, thank you.
Okay, just checking. Okay, so if we can move on then to the next item, which is about the self-assessment under papers for consideration. So Jackie, did you want to just speak to this? Is that okay?
Would be if I did unmute. Sorry. Yes, I'm happy to talk to this, Chris. So two things, just to make sure we've covered off our governance. All committees within the CCG are required to undertake a self-assessment as well as a review of their terms of reference. So if I just cover off terms of reference, because that's the more simple bit. Terms of reference, I've reviewed, given that the committee, subject to legislation passing, is only due to meet for the remaining months of this financial year. I think I was happy that the terms of reference as they currently stand are fit for purpose for the remaining months. So I just wanted to make that recommendation so that Pccc could consider that and recommend to governing body that there are no changes required. In terms of the self-assessment, again, it feels a bit strange given where we're at for only having a limited amount of time for the remaining months of the current financial year, but I do think it would be helpful for people to reflect on the effectiveness of the committee and have we undertaken the role that's allocated to us. You will note that the Audit and Integrated Governance Committee did receive a report on the operation of all committees. So they've done some of our work for us. So they've looked at how we've conducted our meetings and how we've met our terms of reference. So that is included within the report. So hopefully if this committee is happy with that, we can use that as evidence of our part of our self-assessment. But then I've also suggested that we undertake a short survey to see what members' views are and how effective the committee is. And I've laid out some questions that I am proposing helps us to undertake that self-assessment. So I'm happy if people want to, consider whether they're happy with that as a general approach and specifically whether they feel the questions as set out in Appendix 2 cover the scope of the operation of the committee.
Are there any questions or input to that? Can I just say that it was useful to the audit committee to the sections they filled in, and myself and Abby were able to add some more evidence of things that we've done on the committee in that section. So it's just if you've got some feedback after this meeting about the questions, then please let us have it. I was just looking at 2.6 about the relationship between the work of the PCC and other committees is clear. I think it's just a typo that should say effective, not effectiveness.
Yeah.
Is that okay?
That's fine. So Chris, can I suggest we set a timescale for feedback, and then once that's closed, we'll see if we can do a short electronic survey incorporating these questions. So it might be a task that Ronnie might want to embrace, and then if we get that out to committee members for the end of for return by the end of December, we can report that back to Pccc in January. Okay, so you think 2 weeks for actually changing the questions or commenting on them from today? If we could take it to the end of November, and then
the end of November, and then if we can get this out in December and including a timescale for the return, which isn't too long. I think, again, if we get it out early December, a couple of weeks should be able to turn it around. That's fine. Okay, and just to note what Jackie said about the terms of reference, and which is the second recommendation, and the first one is about the time frame for the self-assessment. So I think we've covered those recommendations, or there are actions to cover them. So if we can pass the recommendations and then move on to the next item, which is about the, which is Thomas, or is it Tom? I don't know if this is your Sunday name, Thomas, or you
Tom's absolutely fine.
Tom, okay. So can I hand over to you to give us an update on the digital programme?
Of course. So good afternoon, I'm Thomas Cragg. I'm the Deputy Director of IT Development and Improvement. So just regarding Paper F, which is the digital programme update. Again, KPI 1, we didn't meet the 95, it was 90.26%, but combined with the fact that our average answering time on the service desk is 39 seconds, we're still really pleased with the service that we're offering from the service desk, and we've had some excellent feedback across a number of customers this month regarding that service. We are making some staffing changes. There's a fixed term contract to come in, and we're looking at an apprenticeship on the service desk and in IT to bolster that and to make sure that we get close to that 95%. In regards to Gpit Refresh, we've placed the orders now, and we've started to receive hardware deliveries into both Greenwood and into 722, ready for delivering Gpit Refresh. And the Wi-Fi rollout. So having carried a risk around the controller delivery and the access point delivery for a few months, those we updated at the last Pccc that the controllers have been installed. We've now managed to install access point at 16 practices and 4 lift buildings, and we've received some positive feedback from a number of sites regarding the wireless provision. So I'm really pleased with that project and how that's continuing.
Thank you, Tom. Is there any questions for Tom or feedback? Okay. Thank you, Tom, for that. I think you're contributing to the private session as well, aren't you? Okay. The next item is the reports for noting. So we've got our plan for improving access for patients and supporting general practice, which is really key for us. I don't know if there are any comments on that or any points that people wanted to raise about that report. Okay. So the next item is any other business? No. In terms of escalation of risk, it's not really escalation of risk, but it might be useful to feed into the audit committee the progress about the self-assessment, so that they can be assured that that's happening. And the key messages to the governing body, I think it would just be the discussion we've had about the GP retention plan and the winter pressures about progress with those, which are also key issues for the governing body. So if we can feed that up, Jackie's nodding, so it looks like I've got those two are appropriate. But if there's, if there is another item that that isn't on here, they already will be looking at the budget. So, okay, well, we have gone through the agenda quite swiftly. So if I can call a meeting to a close and stop the video recording. Is that Lucy, are you doing that? Thank you.